I'm going to turn it over to Nicole Alexander Scott, and she'll carry us into our last two presentations. We likely won't have time for questions for the panel, so submit questions online and we'll do our best to answer those questions online. Thank you. Go ahead, Nicole.
Excellent. Hopefully you can hear me fine. Thank you for this opportunity. It's a particularly special day for me because it's my last official day as a state health official after almost 7 years. And there are a few topics more important than what's being discussed today in terms of having a strengthened public health workforce. One of the phrases that I have adopted to incorporate to all of our discussions about workforce is ensuring that our strategies are trauma informed. I can certainly speak to that, and I'm sure both current and prior health officials can speak to the fact that what has occurred over the last couple of years, particularly for the workforce we're referring to, definitely requires some form of a trauma lens to help us navigate and better prepare for how to go forward. Understanding and processing what has happened, really making sure that the workforce has time to heal, and that those additional trauma-informed strategies are incorporated into what we are looking to use to attract additional members of our workforce into. They need to understand that there's a recognition when you join this workforce, you are running towards the fire. It's a noble and honored profession to join, and there is a support system that recognizes what you are willing to take on. So an approach to workforce strategies can be considered across 3 categories. One is your current public health workforce and being sure to incorporate a broader understanding of public health workforce than just the governmental public health workforce. And we've heard many of those very strong examples today of how to expand beyond that, and it incorporates members of the community and so much of the work that workforces can contribute to in advancing public health. There's also the current healthcare workforce, which is oftentimes what people are most familiar with and are referring to, and certainly intertwined with the public health workforce, and probably both of them together could reflect the population health workforce that has been referenced. A third element of our workforce discussion is the focus on creating a diverse, competent pipeline for going forward. And there's certainly different timelines in doing that, starting now with the education of students, but then also creating that pipeline for folks who may be in a workforce and looking to join into the public health workforce. To spend a few minutes on creating that diverse pipeline, I want to be able to share one of the examples we've experienced in Rhode Island, and I know has occurred in many other places throughout the country. Philly also had a program similar. Our community health workers really serve as a prominent workforce that is oftentimes overlooked or not understood, both by others or for themselves. And some of the work that we have incorporated into professionalizing community health workers has included a certification process that recognizes people may or may not have a high school diploma. They may or may not be able to speak English, but they can still bring a wealth of knowledge and life experience to the public health workforce that is valuable and necessary, whether serving as a navigator or a housing authority worker, or someone who's helping to create nutritious options in a community. It's making sure that there is an approach that takes into account those types of diverse backgrounds that are valued and necessary for joining the pipeline of the public health workforce. So we in Rhode Island partnered with an accreditation board for community health workers that recognized the barrier that can exist if you require a high school diploma or a particular level of education or ability to read, and looked at creative, simplified ways to allow for application, also elevated the importance of experience, created opportunity for gaining additional hours of experience, and a process for supporting folks from a diverse background into the pipeline of gaining a community health worker accredited certification. One of the important steps to that role was for us as the Rhode Island Department of Health, state and local public health agency for the state, to partner with Rhode Island College, an academic institution that really focused on joining with us to not only support this accreditation process, but to also create the Rhode Island Community Health Worker Association as a home base infrastructure for all those interested in this field, whether you're certified or not, to become a member and participate in this association for community health workers, and to provide opportunities for continuing education, opportunities to learn about job availabilities that are present, opportunities to advocate for proper reimbursement or pay or funding of community health worker roles, and really to be that entity that advocates for this field as a valued profession that needs to be recognized for what it brings to our entire public health workforce and population health workforce as well. So that partnership really creates a pathway, not only for bringing people from diverse backgrounds with various levels of life experience that are critical, but also allows for continuing education opportunities, such that if they wanted to, with that community health worker certification, they could then go on to become a specialized community health worker, whether that's within behavioral health or HIV care or housing or other realm, and could, as a part of connection to the college and other universities in the state, have the requirements to begin applying for additional licensed job opportunities, a CNA or RN or some other form of healthcare worker or social worker or other license opportunities. So really strengthening the pipeline possibility across the entire realm of the workforce. I'll finish with saying one of the things that are important as we talk about the tremendous work, whether it's the public health core or the regionalization, the recognition of community health workers as a valued profession, it's also about ensuring that there is a diverse array of opportunities of the types of roles that they can step into. And the two categories that I like to highlight as we talk about advancing health equity is the one that people are most familiar with, which is the realm where you have the community to clinical linkage that's strengthened. And that's certainly a place where community health workers can add tremendous value, going out into the homes, helping to ensure that the medication you received for your asthma, you have, the proper supports in terms of environmental exposures or access to your pharmacy or other ways to prevent ED utilization as just one of many examples that are possible. But there's also that pathway of strengthening opportunities to connect directly with the community, not having to go through the clinical lens, but being able to have a community health worker engage directly with the strengths of the community. And that's where our Health Equity Zones initiative, as a place-based model in Rhode Island that mirrors similar ones throughout the country, is a perfect example where community health workers are by far not the only public health workers that are helping to advance and strengthen the work of our health equity zones, but are valued public health workers who can offer a tremendous amount of resources to the communities and connecting to a garden or advancing policies that are necessary to improve the upstream root causes of health inequities that exist, and many others, some of which you've heard today and may hear even further with our final speaker. So having the opportunity to really be intentional about how we grow a diverse and competent public health workforce pipeline is critical. I'm thrilled to share some great examples from Rhode Island, and also to be able to highlight the importance of all of our strategies being trauma informed as we go forward. So thank you for the opportunity.
Thank you so much, Nicole. It's nice to see the bridging of these different topics, from recruitment to career ladders to thinking about the collaboration across the population health workforce and the different entities, whether it's clinical settings, community settings, formal agency, public health, governmental settings. So thank you so much for sharing about Rhode Island.